My son, my daughter, my partner, my family member doesn't look at me in the eye whilst talking and doesn't maintain eye contact. I wonder whether that is autism. That is one of the most common myths, that simply just because someone doesn't establish eye contact can be someone who has autism. That is but just only one feature that we can see in someone with autistic spectrum disorder. So let's talk about the assessments and what happens in autistic spectrum disorders. Hi all, Dr. Raman Sakhuja here, consultant psychiatrist and a professor of psychiatry in the University of South Wales. Welcome to my channel. You know that I make videos right here in Cardiff on common mental health topics and try and give you more education and tips to manage certain conditions, and also give you the services that are available right here in Cardiff. So please carry on watching and we'll talk about autism today. When we look at autistic spectrum disorders, we are largely looking at a range of things that include language problems and communication problems, social anxiety and social interaction problems, along with certain repetitive or restricted behaviors and interests. And all of these need to be looked at in much more greater depth, and an in-depth assessment is required to look at all of these criteria before we end up saying that someone meets the criteria for an autistic spectrum disorder. Before saying that someone has ASD or autistic spectrum disorder, if any of your friends, family, or any other person who you are concerned about and think that they may have ASD, it is much better to go and get them seen by a qualified specialist who can do the detailed assessments and help them to establish whether or not they have that diagnosis. And if you have liked this video, please subscribe to the channel, like it, share it, comment, and don't forget to press that bell button icon so that you get notified for all the upcoming videos on the channel. All the best.